sympathetic and parasympathetic autonomic nervous supplies to the heart form the cardiac plexus, which is located close to the arch of the aorta. The fibers from the cardiac plexus accompany the coronary arteries and reach the heart, with most of them terminating at the SA node, AV node, and a much less dense supply to the atrial and ventricular myocardium. In general, the parasympathetic vagal fibers are inhibitory and reduce the heart rate and stroke volume. The sympathetic nerves act as acceleratory nerves, increasing both the heart rate and stroke volume. The afferent nerves run along sympathetic pathways via both cardiac accelerator nerves and thoracic splanchnic nerves to reach the intermediolateral horn of T1-T4 of the spinal cord. The noradrenergic, the sympathetic nervous system, is mainly involved with increasing the heart rate, chronotropy, contractility, ionotropy, and the speed of conduction, dromotropy, in the cardiac muscle fibers and the conduction tissue, and the transmitter involved is mainly norepinephrine. The SA node receives most of its nerve fibers from the right-sided thoracic sympathetic ganglia and the right vagus. The AV nodes and ventricles receive their nerve supply from the left-sided thoracic sympathetic ganglia and the left vagus, which is mainly because SA node develops from the structures on the right side of the embryo and the AV node develops from the structures on the left side of the embryo. The sympathetic effects are mediated mainly by the adrenergic receptors, which includes beta-1 and beta-2 adrenergic receptors. Beta-1 receptors are found mainly in the SA node and AV node, and the ventricular myocardium acts via activation of adenylate cyclase and an increase in camp cyclic adenosine monophosphate concentration in the cell to mediate the above-mentioned sympathetic effects. Beta-2 receptors are mainly found in the vascular smooth muscles in addition to the bronchial smooth muscle and wall of the GI tract and the bladder. The mechanism of action is same as that of beta-1 receptors, i.e., increasing camp levels, but they cause relaxation of the vascular smooth muscle and are involved in regulation of blood flow and systemic blood pressure. The cholinergic, the parasympathetic nervous system effects in the heart are opposite to the ones mentioned above, and the transmitter involved is mainly acetylcholine, 8-12-13. The vagi supply the parasympathetic fibers to the heart via the cardiac plexuses. The parasympathetic effects are mediated via the muscarinic receptors, which act by inhibition of adenylate cyclase and hence decrease the intracellular camp levels, and result in a decrease in heart rate, contraction, and conduction velocity. The autonomic centers in the CNS, mainly the vasomotor center of medulla and the hypothalamus, regulate the balance between the level of sympathetic and the parasympathetic output to the cardiovascular system, depending on the afferent inputs from the periphery in the CNS. There is normally a tonic vagal discharge in humans, which overrides the moderate tonic discharge in the cardiac sympathetic nerves. Both the sympathetic and the parasympathetic fibers in the splanchnic thoracic nerves and the vagi carry afferent input mediated via baroreceptors and chemoreceptors to the autonomic centers in the CNS. In addition to the efferent output from the CNS, these afferents and efferents are involved in mediation of cardiovascular reflexes as baroreceptor and chemoreceptor reflexes. The receptors of the autonomic nervous system to the heart are the target of numerous drugs used in the treatment of various cardiovascular disorders in both acute and chronic settings.